from the station that's on your side. This is Channel 7 News Daybreak.
Well, tobacco use is the single largest preventable cause of disease and death in the United States. Beginning this week, though, the FDA has extended its authority to cover all products that meet the definition of a tobacco product. So joining us this morning to help explain all this is Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, good to see you, sir.
How are you, man?
This is something you've brought up multiple times. I think since we've started doing segments with you, when we talk about heart disease or any complications with the heart, you always mention smoking, number one.
Right. So there's no question that the uprise of e-cigarettes has just been meteoric over the past 5 to 7 years.
There's shops everywhere now.
Everywhere.
Yeah.
And so what has happened is, to do a little backstory real quick, in 2010 there was a federal court ruling that said unless an e-cigarette can prove that it has medicinal benefit, in other words, that it can help you stop smoking, it comes under the purview as tobacco.
Okay.
So that ruling is what has now played into this current purview of the FDA to say, all right, an e-cigarette, unless the manufacturer can show that there is clinical benefit, in other words, they've done a trial to show that our e-cigarette compared to a nicotine patch or to some other smoking cessation means can help you benefit, then it falls under the umbrella as a tobacco product, which means the FDA can regulate it. Because what we found is that even in the nicotine-free oils and the e-cigarette product, is they still have nicotine in them, and nicotine is a drug, and nicotine is a very addictive drug, and it is not helpful. It's harmful, and so then what the FDA has said is that, all right, we're going to put all of the manufacturers of e-cigarettes under our umbrella for regulation so that then we can test the product. Right now they can't. And moreover, most states have these rules in place, but the FDA has said there's going to be a nationwide mandate that says you can't give out free samples, you can't sell to minors, and so it's going to change the landscape. Of course, their proponents are pushing back, saying, "Wait a minute, we have some rights in this whole process."
Yeah, of course.
But until basically the position of the FDA and the Lung Association and other bodies has said, look, until you can prove that there's a clinical benefit, that you can show that it helps people quit smoking, then it's going to be labeled as a tobacco product. One of the major concerns is that a study that was done a few years ago, around 2013, showed that over 3/4 of the people that used an e-cigarette were still smoking.
Gotcha.
And so this intuitive notion that, well, man, I want to move to an e-cigarette to get off the regular, the regular cigarettes, to get off my Lucky Strikes, well, that's not really playing out. And the other major concern is that there's been a huge uptick in the use of e-cigarettes in the teenage population.
Okay.
A study that was done not 3 years ago showed that some 19% of high school students are using e-cigarettes compared to 1.5% in 2011.
So that number has skyrocketed.
Skyrocketed, yeah. And so the major concern here from the FDA is that it's just going to smoking's going to beget smoking.
All right. Dr. Scott Davis from Baptist Health. Always good to see you. Thank you for coming in early this morning. There is the Baptist Health line on your screen.